You know, if you think about it, essentially all of our regulations are based on one of two premises. The first premise is that every employer, provider, or manufacturer is inherently incompetent, evil, or greedy. And they're going to screw the employees and the consumers if we don't protect them with regulations. And the other premise is that every consumer is really incredibly naive and ignorant. And if we don't have a bunch of regulations to protect them, they're going to get taken advantage of, and they're going to hurt themselves. And this regulation is no different. I know it was well-intentioned, and it was intended to reduce the cost of health care, but I think it will do quite the opposite, because there has to be a cost of compliance here, and that can do nothing but drive up the cost of health care. If, in fact, insurers are making excessive profits because they're paying out too little of the premiums in health care, if we have an open competition, will not new insurers come into the market to share in these profits and therefore drive down the cost of health care? You know, our problem is that our regulations are preventing competition. And competition, I think, will do what this regulation is intended to do, but cannot do because it will simply increase the cost of compliance and therefore drive up the cost of health care. Why shouldn't we reduce regulations and let the market drive down the cost of health care?
Mr. Bartlett, you could not be more correct. In Virginia, across the river from your state, a company called InHealth announced right after the health law passed that it was closing its doors, a new innovative offered primarily high deductible plans, because it saw this regulatory steamroller coming at it, and it basically lost investor support. So people lost that opportunity for this new innovative company to provide those options. Unicare has basically left the individual market in Virginia, leaving about 3,000 policyholders without their options. So the lack of competition, and you're so right about the regulatory compliance. When you look at this MLR regulation, page after page after page, about how insurers have to document their medical loss ratio. So that's it costs them money to go through administrative hassle to prove to HHS that they're going through the right administrative hoops. So it's chasing our tail. It's completely, it's working against ourselves and actually thinking about consumers. And you're so right. People have said, healthcare is just too important to be left to consumers. Well, it is not. People are smart if the market will respond if those options are available, but they're being crushed by regulation.
If I could respond briefly, I went to the University of Chicago, so I believe in market competition to a point. World Insurance Company, one of the companies that is leaving Colorado, was fined $153,000 by the Colorado State Department of Insurance for a number of marketing problems, including the fact that it excluded coverage from skiing as a high-risk activity. Well, in Colorado, a lot of people ski. And so I think that when a company is fined or is even barred from a market for regulatory purposes, sometimes it is a good thing and sometimes it helps consumers. Not everybody who wants to sell insurance should be allowed to do so. With respect to competition, though, in insurance markets, it's really complicated, and health economists have studied this for years. Just an example of this, I heard the other day, and I can't substantiate this, but I believe it's probably true, that in one of the states where a new cooperative was trying to form under this new law, one of the big insurers had gone around and told providers, if you sign a contract with them, we're going to terminate your contract with us.
But sir, if we had open competition, and if we didn't have regulations that kept new people from coming in, wouldn't the marketplace take care of this?
I don't believe so.
You don't believe so?
No. I think if we did that, we would have basically about 2 or 3 national insurers in every state.
Sir, that can't be true if other people can come in. We're now going to have fewer and fewer insurers because your regulations are driving them out of the market, and you're achieving exactly what you set out to avoid. with your regulations. Thank you, and I yield back, Mr. Chairman.